Hi class, I just want to begin this video first off saying go Patriots tonight. So this week we looked at Oliver and his case study, and we were all asked to respond to a question. So my question was, discuss your thoughts about abstinence and harm reduction in general and as it related to his story. Should they have been offered as an option? Why or why not? Well, personally, I think with any substance abuse problem, abstinence should always be an option. Um, it's not always, doesn't always seem like an option with every patient dealing with a substance abuse problem, but ideally when we have a patient that does have a substance abuse problem, abstinence is where we would like to see them achieve. Looking at Oliver, I believe that abstinence is only successful in collaborations with other treatment methods, like discussed in this case study. However, in this case study, we saw that Oliver had a constant cycle between abstinence and relapsing, abstinence and relapsing. So as a social worker, I think that it's important to look at why Oliver kept discontinuing his abstinence. It discussed in the case study things such as Oliver's refusal to change and his refusal for treatment. So, as a social worker, when you're dealing with a person with a substance abuse problem that keeps having that constant cycle between abstinence and relapse, it's important to really look at why they keep relapsing. Like I said, I think that abstinence should be an option for every patient, even though it was something that we saw Oliver struggle with. Oliver, it mentioned in the case study that he was not satisfied with AA and refused rational recovery. Also, Oliver was not able to admit that alcohol was his main problem, and he acted in denial and refused to change. So as a social worker, if I was dealing with Oliver, it would be important to realize that and find ways to help work around that to best help Oliver and his family. I just wanted to share a few things with you guys. After reading this on Oliver, and being assigned this question, I researched alcohol abstinence. And alcoholabuse.com offers information supporting alcohol abstinence. And it provided reasons of why alcoholics should remain abstinence, including their loss of dependence on alcohol, learning to enjoy other things that do not involve alcohol, as well as a reduction of risk associated with continuing the use of alcohol, such as the health problems associated with that. And also they provide tools to help patients maintain abstinence, those including therapy and cognitive behavior tools, and we saw some of those demonstrated with Oliver.